I think this creates an enormous opportunity to really move forward in long-term condition management, not just around diabetes. And I think it gives the opportunity for patients really to start to self-manage effectively. And self-management isn't just about interactions happening in the surgery. Patients only interact with their clinicians for maybe about 2 or 3 hours a year at the very best, and they're with themselves the rest of the time. And this gives them the opportunity to be able to explore their records, see what their latest results are, prepare really effectively before they come into their next consultation with their clinician. I think it'll be a really important and useful step for processes like collaborative care planning, so that people again are really well prepared to be able to go and meet their practice nurse or their GP to be able to discuss particular conditions. But I also think it gives an enormous amount of flexibility in terms of practical aspects of managing your own condition. You can see when your medications are due. You can perhaps even begin to look on your records to see when various processes are due, when you're next due to have blood tests, when you're next due to have diabetes or asthma checks, and really begins to put the patient in charge of this. And I appreciate this, it's probably not going to be for everybody, and there's some people who may feel very threatened by the process. But one of the things that I think is great, if we can allow those people who are going to be able to self-manage very effectively and confidently do it without necessarily taking up so much healthcare professional time, I think it then gives us the opportunity to be able to devote more time and effort to the harder to reach communities and to be able to deliver more effective care for them, and to design processes like this for people who maybe don't have English as a first language. So this is an exciting beginning, but I think it's got a long way to go to be able to reach its full potential, and I think that that's even more exciting.